Hello and welcome to the 27th Degree with Chris and Nancy. Today we welcome audiologist Dr. Nancy Duncan. Before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform, and by following us on Facebook and Instagram. Also, please remember to leave a review, and of course, 5-star reviews are always greatly appreciated. So it's great to have you here. Thank you so much.
Thank you for inviting me. I appreciate it.
We've shared patients for many, many years.
Yes.
And I'm finally getting to meet you after probably 25 years or so.
Give or take. We just celebrated 20 last month.
Right. So tell us a little bit about yourself and how you got into audiology. Let's start with that.
Well, I wish I had a glamorous story of I aspire to do this always, but I was going to school for communication disorders, and the normal pathway is to be a speech pathologist. And as I started taking more and more courses, I realized that wasn't for me, but I'm not a quitter, so I was going to continue and then figure things out. Right. But there is no undergraduate degree in audiology, so I had to take an audiology course. At that point, I fell in love with it because you know right away what's wrong with the person if you can fix it and how to proceed. And I liked having that certainty. So when it came time to choose a course path for our master's degree, I went with audiology and then haven't looked back since.
That's great. Cool. So audiology, is it a master's or a PhD level?
So when I went in the dark ages, you just had to have a master's degree.
Okay.
So when I got out, I had a master's degree. You had to do a year externship after you finished your degree. And then came the doctorate. So it's a clinical doctorate in audiology. So I went back and got that.
That's great.
And I finished that in 2005.
Right. Quite a process.
It is, yes. Yeah. But I mean, it definitely gave you the ability to specialize and feel more competent.
That's great. That's great. So why don't we start with the most common thing you deal with? I'm assuming it's hearing loss.
Correct.
Right?
Yes.
So tell us a little bit about how common hearing loss is.
Well, they estimate there are 28 million Americans with hearing loss. And unfortunately, out of that, only about 10% get help. Part of it's the stigma of being an aging process.
Right.
Some of it is nobody comes in begging for hearing devices. But as more and more research comes out, they're showing how the importance of that with cognitive decline and fall risk, et cetera. So we're seeing more and more people at a younger age. But hearing loss is very common. I'm probably one of the few fields where my youngest patient is 4 months old. My oldest is 104. And we see every age across the spectrum. So it's not just an elderly disease.
Interesting.
Nice.
104. Wow.
How come fall risk is increased with hearing loss?
So the more recent studies out of Johns Hopkins have shown that when you're struggling to hear, it creates cognitive fatigue. So I always equate it to think about children. They can run around all day and never be tired, but you sit them in a classroom for 8 hours when they first go to school, they're exhausted.
Right.
Because there's a higher level of attention and focus. And when you're struggling to hear, all of that's multiplied because now you're relying on your eyes to help you, not just your ears. So it creates a situation of cognitive fatigue. And what happens is day after day, having cognitive fatigue puts you at risk for cognitive decline. But if your brain's fatigued, it's not going to help you be aware of changing dynamic surfaces, stepping down off a curb or a step.
Right.
And when you're not hearing well, it brings in your executive function to help with hearing, all hands on deck in the brain. So it takes it away from the things it should be doing.
Right. And then there's, as far as the cognitive decline, it's probably a lot of it is related, I would think, to isolation and
so it's almost like a perfect storm because when someone's not hearing, they tend to regress and not go out as much. And it's a very slippery slope and happens very slowly before they even realize it. But they tend to isolate themselves more. And the more you isolate yourself, especially as we age, we're not going to work every day. We're not out and about interacting with the world. So if we're not then interacting with family and friends, that's what we live for at that point, is socialization. And if you're pulling yourself away from that, it can lead to an increase in cognitive decline, but also just that fatigue portion. I have a lot of patients that say, well, in the morning, my TV isn't as loud as it is at night. And it's because as their brain gets tired, they need more input to overcome that. And so it creates this situation.
So it's a lot of it is like if you don't use your muscles, you have atrophy and weakening.
Correct.
You don't use your brain as you normally would because you're isolated and not hearing appropriately. Same thing happens.
Correct. So they've done functional MRIs and shown the atrophy in the brain over time, especially in the communication sections of the brain, because it's not being stimulated. It's like any other muscle in the body. If you don't use it, you lose it.
You don't use it, you lose it. That's a great way to look at it.
Yep. So we really try to stress that to patients because it's also a safety issue. especially, as we age, independence becomes an issue. We want to stay independent as long as possible. But if you're not hearing smoke detectors, fire alarms, a knock at the door,
Right.
it becomes challenging. Even driving, AAA did a number of studies and showed that elderly drivers got a bad rap of being slow reaction times. And that really wasn't the entirety of it. It was they weren't seeing and hearing as well. So they didn't have as much time to react by the time the things got close enough for them to hear them and see them.
That's interesting.
Yeah.
Now that more people are wearing like headphones and earbuds, does that harm hearing?
Yes. So when I first started, 25 years ago or so, we saw a lot of people who'd worked in the factories and they'd worked in noisy occupations. But then the advent of OSHA came about. And so that's been lessened to a certain degree because people have to wear hearing protection above certain levels.
Right.
We're now seeing more hearing loss due to recreational issues, shooting, riding motorcycles, listening to radios loud, listening to headphones, things like that. And so we're seeing that shift. So it's almost self-inflicted at this point.
I was listening to something on my phone the other day, and I got that little message. Your volume's really high. You should turn it down now.
Correct.
Not where you're concerned.
You should probably go for an evaluation. Then.
Oh my God, it's selective hearing.
Yes, that's God's gift to men. I say you lose women's voices first. So,
do you really? Is that
Yes,
true?
the high
correct.
pitch.
You use the high pitches first, just because of the way the cochlea is designed. So it's tonotopically designed, meaning the high frequency hair cells are at the beginning. They take a beating throughout our lives. Every sound has to pass by them.
Right.
So if
We
I
lose that
want my
first.
husband to pay more attention to me, I'm going to talk really low.
Drop your voice. Yep.
Yep. No, but I have patients who come in all the time and they say they have trouble hearing women's voices, but they're okay with men's.
Oh,
It's
I did not
interesting.
know
Yeah,
that.
and that's because the bass tones, maintain their integrity longer.
Yeah.
Oh, sure.
Yeah. Generally, if we see somebody with an exclusive low frequency loss, it's viral. It's a disease pattern that they're seeing. Because to get to the center of the cochlea, it takes a lot for that to happen.
Do we know when we're losing our hearing? And I know that sounds like a silly question,
Not at all.
but
What?
What
excuse me, I'm
happens?
talking to the doctor.
Well, what happens is the person with the hearing loss is often the last to know. And the reason being is it's human nature. Our brains protect us from things like, the dryer keeps shrinking my clothes. I can't figure out what's happening. Never us. But what happens for our patients is they'll say, well, the person's walking away from me. They're mumbling. And my question is, did you marry them because they were a mumbler? Because is this something they've always done? Because usually it's just an excuse. And often in that appointment with the types of testing we do, we can bring them from denial to acceptance just by seeing.
Oh.
Because they don't know what they don't know. It happens so slowly, it just becomes their new normal.
Oh.
Right. It's very insidious. So
Correct.
It's-
It would
it's
be like
like-
dimming the lights a little bit every day.
Right.
You'd never notice it.
it's like patients who have cataracts. It's the same thing. They never realize how much vision they
Good
lost
analogy.
until they have it fixed.
Correct.
And then they're like, oh my God, I can't believe I was not seeing that well. That
Correct.
my vision is so good now.
Yeah, I often equate it to patients. It's almost like pain. If you gradually have pain from an injury and don't realize it, you know you're in pain, but you don't know how much until you have it fixed. And you're saying, how did I
True.
live like that? That's often what happens to our patients. But studies have shown that people often wait 7 years before having it dealt with.
Really?
Yeah.
I was going to ask you that. Do you find that you have hearing loss being in a band?
No, I'm very careful. I mean, we play at normal volumes. We try not to play loud. The worst thing in the band is the drummer because you can't control the volume and the cymbals are brutal.
Yeah.
But, everything else, if you can play below that, and if you can have them play like an electronic set where you can control the volume, which we usually do, it's much, much better.
Well, and for musicians, there are obviously the in-ear monitors, but those can be costly. But they have just hearing protection that has
Right.
filters in it, so you can filter out certain dangerous sounds, but still hear the sounds of your instrument, so you can still harmonize, etc. And those are a lot less costly and effective. They're very effective. So we'll often put stronger filters for practice versus people who are gigging.
Oh. So what are those things that you can control to prevent hearing loss? Like obviously not wearing headphones and jamming out at like
Right.
10.
Right. I usually tell parents, especially because they come in with concern about what about my child and what they're listening at.
Right.
You should still be able to have a conversation if you've got headphones in. And we all have, my son's 17. So if I walk in the room and start talking when he's gaming, he often can't hear me and I'll say volume's too loud. Because you should still be able to hear what you're hearing, but hear to have a conversation. That's generally a good volume point. But protecting your ears from things like lawnmowers, chainsaws, household things a lot of people don't think of.
Right.
Never mind musicians. Dentists have a lot of hearing loss because of the drills, the high-powered drills
Oh,
they
that's
use.
right.
Firefighters because of the noise of the sirens and the engines.
Makes sense.
So we see a lot of things like that. Hairdressers, a lot of hair dryers nonstop, day in and day out.
Yeah.
Um,
Things you don't think about.
correct.
I mean, we always think about, you know, things like people who work with, table saws and that type of thing. But I would never think a hair dryer would be something that
Right,
would be
because
damaging.
the scores are like 85 decibels over 8 hours. 85 decibels isn't that loud. If you're listening to that level of noise for 8 hours, it can create hearing loss. The higher the level of noise, the lower the amount of time you can spend safely.
So headphones, you said something interesting where you should still be able to hear someone when you're wearing headphones, but what about the noise canceling headphones?
That's been tough. I mean, I have my Apple AirPods and you
Right.
can't, and that does little to do with volume, but it's a good judge because our phones now will alert us. They've put that safety mechanism in that it's getting too loud. So I always tell people adhere to that because it's valuable information.
Yeah, that's interesting.
So when I'm at home and one of my family members can't hear, what are some of the things I'm picking up on? Like I'm repeating myself a lot, but what else?
Usually, especially in the early stages of hearing loss, it's more mishearing. So you've said something about a cat and they're asking about a bat. And you're saying, what does
Okay.
that mean?
Yeah.
Because they're not going to lose all of their hearing at once by just losing the high frequencies. They lose the speech sounds that give us the perception of clarity. So they're still hearing the volume, and that's why they'll say, I hear, but I don't understand. So you'll hear that a lot, or people are mumbling, or it sounds garbled.
Okay.
Or, oh, it's just noisy, that's why I can't hear you, especially if it's an environment you're not struggling in. Those are some signs that you'll see at
A
first.
lot of my patients say I'm okay until I'm in a restaurant and I can't hear what people are saying when there's other noise around, or I'm watching the TV and I can't hear it and I have to put the
Captioning on.
captioning on and that. So that's something that's noted.
Yeah, and I have a lot of patients that will say, oh, well, the TVs these days aren't as good as they used to be. And I
Yeah.
said, it's not the TVs, it's your ears.
Right.
But we actually do some functional testing where we put people in a restaurant environment sound-wise in a sound field.
That's cool.
And we do the testing without anything on, with corrective devices, and then with corrective devices and accessories. So we can show that progression, but also then ask questions about listening effort, confidence, how long they could stay. So we can show where the shifts can be had to lower that cognitive fatigue with them.
What are the most difficult situations that people have a hard time hearing in?
Restaurants, hearing at a distance, hearing when people aren't facing them because they don't even realize they're relying on their eyes rather than their ears to hear.
Oh.
That's why when masks came about with COVID, that was an eye-opener for a lot of folks. So when we were able to
Right.
open back up, we didn't know what to expect. We had never been busier. And it was because suddenly people who had been in denial but getting by realized they couldn't
focus.
anymore.
I still wear a mask in the office and I have a lot of patients I have to take it off for because they just can't tell what I'm.
Yeah, we did the
Trying
clear
to say.
masks throughout COVID, and
Oh, yeah.
it's those are a nightmare, but
Yeah.
necessary. But it's like a rainforest when you're talking. It
Oh,
was awful.
Oh yeah, that
Great.
doesn't sound good.
No.
I have patients I've taken care of for a long time, and some of them come in and they really can't hear that well, and I'm like yelling during the visit, and I'm thinking, my God, I'm in there for whatever, a half hour with them, and I'm exhausted. What's it like to the spouse at home who's doing that all the time?
Yep. And that's the thing. A lot of times, until we have them in the office and we can have them both giving us information, so we
Sure.
always request that they bring somebody with them. Not because they can't make decisions on their own, but I want them to hear what the other person has to say about the situation because often they don't ever realize it's affecting them.
Right.
They think, well, they just can turn the TV up. They can just repeat themselves. But then the person's saying, I feel badly because they're shut out. They're not able to have a conversation. I'm having to be their translator when we're out in the world. And that's sometimes eye-opening for the person with the loss because it doesn't ever occur to them that it could be affecting someone else.
I mean, a lot of my patients who end up going for testing and ultimately get hearing aids, it's because their spouse kind of demands it of them.
Oh, yeah.
They don't want to do it, but
That's one of our questions. Are you calling for yourself or someone else?
Right.
And when we get there, what brings you in today? And often
Right.
they go, she did.
yeah. There's a lot of that happens.
Yeah.
Yeah.
So, Dr. Duncan, when someone first starts with hearing loss, is that at the point where they go see you, or?
We recommend, whenever you start to suspect it, even if you don't feel you're ready, get a good baseline. I recommend starting at age 60 because
Okay.
that's when we generally will see changes just from a lifetime of sound. There was a study done, I think it was in the 50s, but they found an indigenous tribe somewhere that had no electricity, no power, no cars. And they tested the elders and they had normal hearing well into their 80s. So they didn't feel it was necessarily an age-related process. It was sound exposure over a lifetime. And we live in a noisy world. So I recommend age 60 starting at least with a baseline, and then every year after that, just like we do with our eyes.
Why is it that people who are exposed to loud sound, let's say in their 20s and 30s and 40s, they may be okay at that point, but years later they'll develop hearing loss?
It's somewhat cumulative. So then you
Mm.
add just the rest of our lives of noise.
Right.
You know, we listen to music, you go to concerts, you go to different clubs or bars or things,
Right.
and it just all becomes like a perfect storm for this
Yeah.
to hit later on. Um,
I think about, so my grandmother worked in the mills in
Mhm.
Fall River, and she was born and raised in town here. And as she got older, and she lived to 103,
oh, wow.
but as she got older, she started to lose her hearing. But she wasn't exposed to those loud noises anymore. It just, it progressed. And it was interesting, when we'd go out for lunch or whatever, I'd always say, okay, make sure you bring your hearing aid. And then occasionally she wouldn't, and it was impossible to communicate. And then sometimes she wouldn't bring it because she didn't want to spend money on batteries, and she was rationing batteries.
Mhm.
And it's like, you have to be able to communicate with people.
Right.
But that's common, isn't it? The whole
It is. And
battery
thankfully
issue.
now they're all rechargeable.
That's good.
So you don't have to deal with batteries as much. But you're right. A lot of people think they can just wear the hearing aids when they need them.
Right.
And we always really strongly suggest to patients that's not the best way to go. That would be like wearing bifocals part-time. Your brain
Right.
needs to adjust and get used to the new way, and it can't keep going back and forth or you'll never be successful.
True.
So do you ever get your hearing back? I mean, say you have hearing loss. Is it just dependent on what caused it, or
Yeah, it depends on the cause. So when we talk about hearing loss, there's conductive, which is more of a mechanical loss, sensory neural, which is a nerve damage, or mixed, which can be a combination of the two. With a conductive loss, it can often be remedied, whether it be surgery, if it's an infection in fluids there,
Okay.
that would be a conductive
Yep,
loss.
yep.
Wax in the ear, so sometimes it's a temporary shift. So it depends on what the cause is, but the most common is that sensory neural, which is a permanent change. And I always tell patients, they'll say, well, my doctor told me, and this is usually old school, my doctor told me there's no cure for this. Hearing aids won't help. I have a nerve loss. That's the only type we can help. But it was just this misconception for so many years
Right.
that we're really still trying to battle against.
Yeah. I get some patients who come in, this is always frightening as a physician. They have like a sudden hearing loss, usually a viral type process. And I mean, those patients, they go from hearing what they think is normal. Maybe they aren't normal completely, but to like no hearing in one ear.
Yeah.
Or sometimes both, but usually one. That's pretty frightening. You must see that sometimes too.
We do, and we've trained our staff highly to ask that question of when did this start? Because if they say today, we're going to see them during lunch. We're going to stay late and see them because they need to be on prednisone within 24 hours, or else that hearing loss will be permanent. Sometimes it can come back with steroid treatment.
Right.
But often I've seen, not from your office, but from some offices where they just automatically say, oh, it must be an infection, here's some antibiotics. And they do a 2-week course. Window's gone. We've lost our hearing now at this
That's
point.
right.
So we have a physician resource page on our website for things like that, sudden hearing loss, tinnitus, how to fast track these people and where they need to go. And sometimes we're not the answer, but we want them to get the help.
So someone walks into your office, what is the process? What do they go through as the typical patient?
Yeah, so a typical patient, obviously we sit down and do a case history. I mean, they've completed it online ahead of time, but I really dive a little deeper into it because sometimes they maybe didn't understand the question or what have you.
Sure.
Get a feel for what their family history is, what are their symptoms, what's their exposure to noise in the past. Then we take a look in their ears, make sure wax isn't the issue. And we have a video otoscope, so people are usually ooh and ah over that because they can see inside their ear for the first time. If there's wax, we remove it. Then we do your basic tests that everyone's probably experienced through elementary school when you hear a beep and either raise your hand or press a button. Do some word testing that will test the integrity of the auditory nerve because for some people, no matter how loud we make it, it's not clear because the nerve isn't sending that message to the brain for interpretation. Once we get through that, that's when we do some different testing that really no one is doing at this point. But we felt there was a better way because nobody comes into our office or calls us up because they're not hearing beeps. I mean, let's be realistic. But that's what we've always tested for. That gives us the prescription, but that doesn't tell us what their real life is in the world. That's not how they're functioning. So that's when we come up with the testing in noise to really see what's going on. It was testing that had been designed for cochlear implantation to test candidacy. But we thought, why can't we do this to see what we can improve, where we can lower that listening effort and really make a difference? So we started doing that about a year ago. And that has really brought people very quickly out of denial because they're sitting there going, what did you do? I can hear better now. And then when I take the hearing devices out of their ears, they'll say, Well, that was a trick because I didn't hear like this before, but they just didn't know what they didn't know is the
Right.
problem.
It's
I
such an
love
insidious
that
process.
because it just brings it like right home.
Right.
And it
Because
probably is relieving to them too. It's like, oh, I don't have to be in this same situation.
right. And then, once we explain to them the risks, it's not just communication factors, it's all these underlying risks. That's usually somewhat motivating. And we have a cognitive screener we do as well because studies have shown if they're not yet at the level of dementia, Alzheimer's, sometimes their cognition ability can improve slightly if they fix things like vision, hearing, being more interactive, diet, exercise, all of these things. So we can test that throughout.
Yeah, I think that's great. I mean, just to get that information out there that dementia can be a risk factor of hearing loss should incentivize some patients to
It
be
does because
evaluated.
nobody wants that to be their
No,
future,
of
and
course
you
not.
can't turn around and change it if it is. So we want to make sure that we're getting to those risks sooner rather than later.
Right.
So I have a feeling you might be disappointed in me
Okay.
because I really like Q-tips.
Mhm.
So can we talk about waxy ears and what are we doing for that and what's the best to do?
Yeah, so Q-tips are not our friend because what often happens is, yes, you'll get some wax out, but you've pushed that much more in.
Yeah.
So I've looked at a number of ears, and you can see the shape of the Q-tip in the ear, and that's an uphill battle to get that
Yeah.
wax out. If you know that you have a waxy ear, some people have more than others. I would recommend every 6 months having it looked at by your physician, an audiologist, somebody, so they can give an assessment of should it be cleaned out. You can use over-the-counter drops, provided you've never had a perforation in your eardrum or surgeries or anything like that on the ears. They're just over-the-counter drops you can use and then flush out the ears. But that's a big part of our job is cleaning them out. So we have a machine that puts water in that's regulated temperature-wise and just flushes that ear pretty quickly.
It's
So-
amazing how many people damage their ears with Q-tips. I see it all the time.
Oh, yeah.
So I want to explore this drop
Yeah.
thing because
Okay.
again, I'm a Q-tip girl. So
Okay.
I'm going to Stop and Shop or something, buying these little ear drops, popping the drops in my ear, and then what? Everything leaks out or
No.
what?
Yeah, for days
What's
it'll just
going
be
on?
dripping out. You'll be
Right?
fine. No,
Good
what
luck.
happens is, you put the drops and usually you let them sit 5 to 10 minutes, and then you want to get a bulb syringe like we have to clean babies'
Okay.
noses.
Yeah.
You suction up some room temperature water. You don't want it too hot or too cold because it
Okay.
can make you dizzy. But room temperature water. So I tell people fill the glass with warmish water, let it sit for about 20 minutes.
Okay.
Then use that, flush it, turn your head, let it fall, wash out that way, and do that consecutively for a few days. You might notice it gets worse before it gets better because sometimes the water gets trapped behind the wax,
Okay.
but it'll eventually flush out.
Can I just do that in the shower without using a little bulb syringe?
You can try. It doesn't work quite as well. It's not as
Okay.
directed. Yeah.
Okay. Got that done.
All
Okay.
right, good.
All right.
See?
No more Q-tips for you.
No, definitely not.
Gosh, after 50
It's really,
years.
really bad.
I know.
It
They
is
should,
right?
be, they should
hard.
be taken off the market, actually.
What do you use for Rebels ears? Do you use drops?
Rebels. So dogs' ear canal is very different
Mm-hmm.
Oh.
than
They're very
human.
deep.
They're very deep. You'll never hit the tympanic membrane. You can stick your finger in there with gauze and go way in, and that's what you do. There's some solution that you can buy that kind of helps to clean out the debris in there. Especially floppy-eared dogs
Yeah.
will get a lot of ear infections.
Right.
So you just take the gauze and you just jam your finger, and you'll never damage their ear. It's amazing.
I had a Rottweiler with chronic ear infections, and you'd rub this solution in his ears, and then he would shake his head, and
Yeah.
it would all fly
Right.
out.
It'd all fly
But
out.
dogs with
Yeah.
thyroid issues have a lot of ear
Yeah.
infections because
Yeah.
he ended up with a thyroid problem.
But they have really huge
Oh, yeah.
canals.
Yeah.
So you can go deep and you're not
Oh yeah,
gonna...
you're not going to hurt them.
Yeah,
You're not
they
gonna
might not
hurt 'em.
like it, and they might not let you, but yeah,
Yeah.
you can go
Yeah.
deep.
Oh,
I don't
Good to know.
think I'm not a vet, but I don't think you can damage their ears doing that unless you
Unless you
really
went
were
really deep.
aggressive.
Yeah.
Okay.
But I mean,
Okay.
I
you
actually had
wanna-
a person once that wanted me to fit their dog with a hearing aid because the dog was elderly and going
You
deaf.
know, that
And
could be a whole new thing.
There was a company that was willing to make one, but you had to go
Yeah.
through a series of training, and they weren't willing to train the dog.
and don't take my veterinary recommendations because I am not a vet. I'm just telling you what I do with my dog.
Yeah. I have a dog I can't touch, so I get it.
Yeah. So
So now, when people think of hearing aids, they think,
Mm.
"Oh, I'm not going to get a hearing aid. It's too much bother. It's too expensive. It, buzzes in my ear, and
Mhm.
I'm not going to be able to hear that." So you can dispel some of those myths.
Yeah, so hearing aids have had such a stigma, just like glasses did at one time.
Yeah.
We all associate it with aging, and let's face it, none of us want to get older. As I hit 50, I'm realizing it's coming fast. But what happens is they've come so far. They're all digital now. We program them. They're like a graphic equalizer, so we can really pinpoint where people need help, give them help where they need it.
Ah.
When I started 25 years ago, it was basically a straight amplifier. There wasn't compression, so loud sounds were even louder. Well, just
And they
because you
were
have hearing
big.
loss, you don't need to hear loud sounds louder. You hear those
Right.
already.
Right.
So with the hearing aids now, they have feedback suppression, so they're not whistling. They're all digital. They're very small and discreet. They work with our cell phones, so you can stream phone calls to your hearing aids.
Oh my
You can have
God.
your phone can be a remote to adjust them.
They're smart head. They're
They
smart.
have a Find My Hearing
hearing
Device
aids.
feature, so you can't lose them as easily. So there's a
Oh,
lot
I
that
would
goes
need
into it.
that.
Me
Listen to them
too.
all the time.
I only have 3 safe spots in my house that I'll put down all my electronics, like my phone, because I lose it too much. So now I've identified safe spots in my house.
My husband has ADD. We have limited places we can put
Yes,
things.
it really works.
I have a musician friend of mine. We play together periodically, and he has some hearing loss, and he has hearing aids. And I don't know if it was from his music exposure, but likely was part of it because back then no one was really too concerned about volume.
We used to think it was cool when
But
our ears
it's
would
pretty
ring.
cool. I mean, he goes on his phone and he just adjusts things, and if depending on what we're doing and.
Yeah, then they can be as simple or as complex as you'd like. You can even create your own memories. So let's say you go to Dunkin' Donuts every morning and you say, this is the perfect setting. You save it.
Right.
It will recognize the GPS settings when you get there, make those changes automatically. So you don't have to do it manually. Yeah.
Oh
So
my gosh.
that's part of why these things are so expensive, I guess.
Yes.
It's the R&D, the technology. It's not really that there's $8,000 worth of material in those
Correct.
hearing aids. It's what it costs to develop it.
Well,
right?
and as audiologists, we kind of did it to ourselves. We grew up in the field. So before audiology could sell hearing aids, there was a time where audiologists could test all day long, but they felt it was illegal for us to fit hearing aids because it was an item for sale. So they went a different route. But now we're finding we followed the same path that the dispensers had done. So we would bundle everything in. So you'd see an $8,000 price tag and think it was just the hearing aid. Well, often it was all the service that came after for the next 5 years. It was the hearing device, it was the expertise of the fitter, et cetera, and the research and development. I mean, the manufacturers, they charge us an arm and a leg, so I can't just give them away. And it goes into all this research. I mean, they have come so far in just my career. My first job, I didn't have a computer. We had a screwdriver, and I'd walk up and adjust and go, how's that sound? That's all we could do.
That's all you can do.
And now we do everything on the computer. So they've come so far, which is amazing, but it hasn't kept the price down. And that's the reality of it.
What are the prices?
They can go anywhere. So we tend to be a little different in that we have 3 price points at each tier because some people don't want to bundle anything in. Fine, you can just get the hearing devices. Some people want the service. Some people want everything possible. So we have those different.
I mean, it doesn't have to be
gradations.
your specific prices.
Well, they can go anywhere for everything from $9,000 down to like $2,700 for a pair,
$9,000.
depending on the technology.
Is the $9,000 like what are you getting for that?
So
Back
you-
rubs every night?
Yeah, sure. You're getting the hearing devices. You're getting generally 4 years of service. You're getting some of the accessories to stream television to the ears, to stream like a remote mic, so I could wear a clip and stream my voice to your ears, even if we were in a noisy place. So there's a lot of features that can come with it and keep them up and running.
I mean, they must work better for most persons than the $2,700 pair.
Correct.
I'm thinking.
So I tell people it's like music. We all listen to records, then we went to cassettes, then we went to compact discs. You
Right.
can hear them all, but you can hear the difference. You can hear the difference in the clarity, and that's what the difference is. We used to recommend based on lifestyle, and we'd say, okay, well, you don't go out much, you go to the doctors, you watch TV, we'll go with something basic.
Yeah.
But inevitably, within 6 months, that person would be sitting in my office going, these are junk. I went to a wedding and I couldn't hear anything. Well, they weren't designed for that. So now I tell patients, listen, we're going to talk about the best because nobody comes in and says, I only want to hear half the things I'm in. They want to hear wherever they go.
Sure.
And I say, if that's not attainable from a price perspective, let me know. We have other options and I can talk about what changes with those options. So we kind of put that ball in their court to let us know where to go next. But the hearing devices have come so far that they really are great. And the nice thing is in the state of Massachusetts, really in all 50 states now, there's a trial period. So if somebody trials them and says, these aren't for me, they return them and get a full refund. So you're not stuck with them. They don't have to put them in the drawer and hide them away.
Is there any program that you can trade up? So if that person that spent $2,700 on their hearing aids last year, if they're like, this doesn't work, they can't trade them in or trade them up, right?
Some instances. So in a couple of our plans, we have a trade-in policy that if you trade in, during that 4 years, and I think of it like cell phones. We all know the folks that get a new cell phone every year, no matter what. And then some folks that wait till the cell phone dies. So we have a trade-in policy. If they trade in during that 4 years, it can either be $500 or $1,000 off towards the next pair. So we try to make that realistic.
That's nice.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
So what's the most common price point that
A lot of people just want to get just the devices, and at the high end, that would be about $4,500 for the pair, $5,500 depending on their insurance discount or benefit.
so they insurance may cover partial
It depends.
costs?
Some do. Some just offer a discount, and then there are others that go through what we call a third-party administrator. We don't participate with any of the third-party administrators. However, and mainly because they would dictate how we do it, what we get, how many visits the person can come in for. And you know, from your own world in medicine, that's not realistic for everybody.
Right.
But what we've done is negotiated the same discount through our vendors so that we can offer that price point, but then give them the level of service we give to everybody else. So we are always transparent with patients when we talk to them about that.
How long do they last for?
Industry average is 4 to 6 years. So usually around that 5-year mark is when most people are looking to replace them. And it's not that they just die. Generally, we start to see more and more repair problems,
Okay.
kind of like your car, where you start to get more annoyed because they're in the shop more than they're on your ears.
Are these water resistant?
They're water resistant because the computer chip is sealed inside of them, but they're not waterproof. And that's
Okay.
where a lot of people make the mistake.
Why would you want to wear them in the water?
Well, I'm not thinking about wearing them in the water. It's just more you're out on a rainy day or something. Are you going to damage them? No, these are.
Yeah, so there's a
things I wonder.
Dolphins talking about.
I do have patients that are near deaf, and there used to be some that you could buy that were waterproof, or firefighters, because they're in water environments they can't avoid.
Sure.
So they did have some for a while that were waterproof. That's changed, but with some device you can buy a thing called the Perfect Dry Lux, and it runs a 30-minute drying cycle and a UV cycle, so it can help with your day-to-day incidental humidity, sweat, rain as you go into your car type of situation.
What are they looking like now, the hearing aids?
The most popular type is called a receiver in the ear. So it's a tiny little wire that's almost invisible that just puts a little cone into the ear, and then the top part sits behind. You don't ever really see them, though, because we can get them to match hair color. So they just blend right in.
It's amazing how small they are now. I mean, sometimes I go to do an exam and I don't realize it.
Right.
Because it's just this little tiny thing.
It almost looks like a fine hair or
and then you're
filament.
like, oh, yeah, you got to take that off.
Yeah. So a lot of people go, I don't want the ones on the ear. And I said, let me
Right.
take a picture and show you what it looks like. They actually are more discreet than the ones that go all in the ear because
They
you
are.
have to have the perfect ear for them to go deep enough to be invisible. And the small, tiny ones, a lot of people will see in advertisements, are generally the same cost as the others, but you don't get connectivity to your devices. They're not rechargeable. So there's a lot of extra cost, and they break down more because they're in the ear deeper where the wax is.
The waxes. Let me ask you about there's all these ads now for these $400 hearing aids as an alternative. What are those like compared to, going and getting a hearing aid more like what you've been describing? What's the difference?
Well, my best analogy for that is when we're looking at glasses.
Mhm.
All of us start where, our arms become not long enough to read the print anymore.
Right.
So you go and get readers at the pharmacy. But you'll reach a point where you need bifocals or you need something more. Most people, if they have a stronger degree of hearing loss, moderate or worse, need something prescription-based, which is what we do. Over-the-counter devices became available recently with the Biden administration.
Right.
They passed the rules. But those patients weren't my patients anyway that need those because those are mild, maybe teetering on moderate loss. So those folks are just questioning their ability to hear and whatnot. So they're not prescription-based. You have to be pretty tech-savvy to use them because you have to have a smartphone. You have to program it yourself with a smartphone. So there's a lot of room for error with that situation. But if you're somebody in your 30s or 40s just suspecting you have hearing loss, it might not be a bad option. But what I tell people is make sure they have a return policy because they don't have to adhere to the same rules we do.
Okay.
And you don't want to spend $700 to $1,000 and not be able to get that back.
Sure.
So that's the biggest thing I say to people.
Now, are they just amplifying all frequencies, or is it more specific? Like it sounds like with the hearing aids that you get from an audiologist, they're much more involved. I think, at least.
Yeah.
where you're amplifying particular frequencies where the impairment rests. But
Correct.
these sound like they just amplify everything, perhaps?
It depends on the sophistication of the device. Some are better than others. So some, like by Bose and some of the big names in the brands, they have better quality ones. Some are just straight amplifiers, which you wouldn't want that, because if I slam the door, that's going to be given as much amplification as a whisper. The other part of that is you want to make sure you can adjust a little more readily. Some other factors are when hearing losses are precipitous and they really drop off in the high frequencies, we have very little of what they call headroom. So the softest level you can hear, and then when things get way too loud, is very small, that window. So we have very little wiggle room there. And so we have to be very careful with setting levels carefully in there, or else we can definitely damage the ears more by giving too much. So that's things to be cognizant of. The other are our single-sided deafness folks, where they have one ear that's dead.
I was just going to ask that.
We would put a cross device on them, where you have a receiver on one ear that sends the sound to the good ear, so that your brain eventually will differentiate that, what we call head shadow effect, that slight time frame difference. They don't have anything like that in the world of OTC, or over-the-counter devices.
I was just going to ask you that, if you only have hearing loss in one ear. Or is that like a plan people can think of? Like if they can't pay for 2 hearing aids, do they always come as pairs?
We recommend, going with the most expensive you can afford for 2 ears if you have hearing loss on both sides. And the reason being is our brains are wired for every information to cross over. So if you're only getting input from one side, it never feels full. It never feels natural. It will sound very sharp and tinny and harsh. And your brain never really gets used to that. It's not how it's kind of like getting a monocle. You can do that, but we wouldn't recommend it.
Right.
But with the devices, when you're single-sided, you can sometimes just get a hearing aid for that side, depending on how the auditory nerve is working. Is it sending that signal clear enough? If it isn't, that's when we go to the cross device, because putting a hearing aid on an ear with bad word recognition is just going to make it sound like Charlie Brown in one ear. It's not going to give any help. So we really have to make sure when we're testing that word recognition, it's accurate, because that's how we make those decisions.
So what are the occupations that or exposures that people have had where they have very unilateral or one-sided hearing loss?
Usually hunters, if they're shooting long
Makes
guns,
sense. Okay.
because one ear is protected,
Yeah,
it's
it makes
down,
sense.
other ear's up. If they're not wearing protection, that's the ear that's going to get it. When I was a graduate student 100 years ago, there was a 16-year-old that came in, had shot a rifle one time, but high power, damaged the hearing in one ear permanently. So it doesn't take a whole lot, depending on the level of noise.
Yeah, I mean, I don't think that patients realize that it can be that damaging, just a couple
that quickly.
shots.
Yeah. Or when you're parked next to a car and the car is vibrating because of the radio. Like, I
Right,
just want
right.
to hand my card and say, come see me. I wish you got hearing loss.
Truck drivers, I mean, they have the window open on the left. Do they get more hearing loss on the left than the right?
Actually, I had a patient earlier today. He was a firefighter. I said, did you always drive the rig? And he
Right.
said, yeah. And I said, because your hearing loss is worse on the left side. So it makes sense, because that's what's exposed to the road noise constantly.
Are there things that people that wear hearing aids like shouldn't do to help make their hearing aids, like for the best care of hearing aids? Like what kind of things do you see where you're like, oh man?
Yeah. Keeping them clean and dry, because a lot of folks don't take the time to clean them every day, but earwax can build up very quickly, and that's very damaging to them. Moisture. So I had a woman today that got in the shower by mistake, but we have a machine that's a heavy duty, thing you can use to put your cell phone in at the cell phone store. We have a version for hearing aids, so we can
Okay.
suction them out pretty quickly if we can get to them. So it's usually keeping them clean and dry, the two biggest things. Keeping them away from your pets, as we talked about dogs earlier. We've seen quite a few chewed. Yeah.
You don't want to be sifting through the stool.
Right.
to find
Yeah,
your hearing
and you got to be
aid.
careful the dog or cat doesn't get the battery, because that's damaging to their intestines.
Oh,
That's
yeah.
a costly surgery for them.
Yeah, right.
Yeah.
Is there an adjustment period? Like suppose you gave me hearing aids today. Like what's my next 4 days look like?
So what we normally do is we fit the person, and then I'll usually give them a call within the week after, because often they're experiencing very normal things, but they don't know. So we talk them through that. But usually we don't start people at their prescription on day one. Unlike glasses, where it's sort of you just have to get used to them, we start them off a little bit softer, and then we'll see them 2 weeks later, see how they're adapting. If they say everything sounds great, we'll then bump them to prescription, and they're doing fine after that.
Okay.
But if you try to get there too soon, what happens is it's overwhelming. They end up taking them out. They won't adapt. They won't
Right.
adhere. So it's important to take it slow. But they didn't lose their hearing overnight. We don't have to give it all back at once.
I like the way you do things. You
Thank you.
got it down.
Well,
You know?
it's the only thing I know how to do. So
No, because a lot of things that you say, it's like, yep, I've seen people do that, and now I know why they're doing it.
And I've worked places in the past where we would set it based on what we call real ear measurements. So we'd measure it with a small microphone in the ear, and we try to do everything to match it. And the person saying, "But I don't like the sound," and my boss at the time was like, "But that's where it needs to be set." I'm thinking, but the best hearing device is one that someone will wear.
Right.
Doesn't matter where it's set. And some people, especially if they wait till their 80s or 90s to get fit, we never get them to prescription. They can't handle it. It's just been too long. So.
Dr. Duncan, what happens if someone is just not going to do hearing aids? What are the best practices to deal with someone who's very challenged with hearing loss? Like,
Scream.
Yeah,
but we already know it should be like a lower, like I should lower my voice.
Lower your voice
that
a
way.
few octaves.
It's hard. I mean, they have things you can buy over the internet, like pocket talkers and things. They're not convenient, but it can be something where they wear headphones and you're talking into a microphone. It's at least amplifying the voice a little bit. But it's a challenge for family members because what happens is they often raise their voice and the person says, "Don't yell at me." And it's hard because you can't look happy when you're yelling.
No.
You can't.
That's so true,
And
right?
so
I
you
never
always look
thought of
angry.
that.
And I had a woman that the only reason she came in is because somebody had reported her daughter to Bristol Elders because they said she was abusing her mother. Well, she wasn't. She was talking loudly but looked angry because you can't look happy.
Yeah.
And she said to her mother, "You have to do something. I can't deal with this anymore. I'm not doing anything wrong." So finally the mother got motivated because she realized it was affecting her daughter.
I have a funny memory of when I was a resident. We had a nursing home that was kind of connected. It was more like I guess it was partly a nursing home connected to one of the hospitals I went to. We never really went up there that much, but at one point I had to go up there to see some of the patients. There was a medical issue going on with one. And there was this woman who was probably in her late 80s, 90s. And I was talking to her and she couldn't hear me. And she pulled out this device. It was like from a Victrola. And she popped it in her ear. It was an ear horn.
Yep.
And I've never seen that since. I thought it was really bizarre.
Well, this is the first hearing aid ever invented. It gives you a 7 decibel boost.
Okay.
But the ear horn gave a little bit more because it's like a Victrola in the ear. But yeah, that was the thing for a while, body aids. I haven't seen one in a long time, but I remember when I first studied.
Yeah, this was a long time ago.
Yeah, the person, I said, "Can I see your hearing aid?" Not realizing she had a body aid. She takes off her shirt because she had it all tucked in her bra. And I thought, oh my gosh, what's happening?
What's a body?
Well, what is a body aid?
So a body aid is the predecessor to all the hearing aids you see now.
Okay.
So for a long time, they still used them on babies because there wasn't anything you could put on babies' ears to keep them safe and in the ears. But it was a box about this big that people would wear in the center of their chest. And so women often would just tuck it into their bra and wear it there.
Okay.
It ran wires up to the ears with these big earplugs that went in. And that's how the sound was picked up for people with severe to profound losses. Hearing aids have made such an advent over time. They used to be built into glasses. So they were built into the arms of the glasses, which sounds great in theory, but then if your hearing aids break, you don't have glasses. If your glasses break, you don't have hearing aids. So it didn't really work well. They had some that were in barrettes at one time or another.
Really?
If you look through the history.
The history of hearing assistance is
really intriguing over time.
But, you think back in the 1800s, really, they had nothing, right?
No, that's when they had the ear horns.
The little ear horns.
So
Amazing.
getting just back to the cost of hearing aids, what are some common payment plans?
So care credit, which is common in the field of veterinary medicine, dental practices, etc., is a plan where people can pay things out if they're approved for 24 months with no interest. We have that available in our office because it is an investment, and sometimes paying it out over time just makes more sense. So we try to have a price point for everybody because our job is to help people hear.
Right.
It's not to decide their finances. So we have, best of the best, and then we have other options. And we even have a leasing program in-house so that if someone really doesn't qualify for Mass Health but needs help, we have something where they could do something as low as $700 down and then $99 a month. So we can break it out over time. So we try to have something for everybody because that's the goal, is to help them hear.
That's great.
I just switched financial planners and I gave her a list of my monthly expenses. I should add this into my retirement expenses.
That's a good point.
I mean, either me or John. I mean,
Oh, yeah. I mean,
one of you will need them.
it's
Right?
one of the conversations we have with people, like, can I take this information home to talk to my financial advisor? Absolutely. Here's, put them on your HIPAA if you want me to be able to talk to them.
Right.
Oh my God, that's crazy. So I know that we've talked a lot about hearing loss, but what are some other common conditions that you see in your office?
We deal a lot with tinnitus as well.
I
and
wanted
that can
to
be
ask you about that.
Yeah, that can be
so.
debilitating for some.
Sure.
And there's varying degrees. So you can have somebody who says, "Oh, my ears have been ringing for years and it doesn't bother me." So they've acclimated, it's non-bothersome tinnitus. And then you have people who are literally non-functional because of it. And they've shown, because a lot of people think, well, it must be because it's louder. It isn't. It's just how their frontal lobe reacts to things, their limbic system. And so we work with those folks on deciphering the loudness of their tinnitus, the pitch of their tinnitus, if they have hearing loss, because often it's a reaction to hearing loss. Because if you're not getting input externally, the brain sends out a signal to try to fix the problem. No different than phantom pain if somebody loses a limb. And if you're not having hearing, what will happen is the brain is sending the signal, and that now becomes the loudest thing in the room because you're not hearing at those frequencies. And so what happens is if we can amplify the sounds they're missing, if they have hearing loss, that can then overcome that and trick the brain to go, nothing to see here, I can stop producing this sound, and it can dissipate. Or often it's if somebody has perfect hearing but they're reporting tinnitus, it's stress related. It's stress and anxiety because their cortisol levels are high. It's just another reaction to the body. And then if we can calm these things down, we give them relaxation techniques. We talk about various things they can do, acupuncture, etc., and really try to calm down their system. It can often dissipate as well.
What percentage of patients have hearing loss associated with tinnitus versus, normal hearing per se?
When they have tinnitus, probably 80 to 85% have hearing loss.
Yeah, that's
I just want you to know, I've been saying my whole life tinnitus, but
either way,
I guess.
tomato, tomato.
Okay.
I mix it up sometimes.
Do you?
Just to keep it interesting.
Keep it even.
Like if a patient says tinnitus, I'll say tinnitus. If they say tinnitus, I'll say tinnitus.
Of course you do.
Yeah, and it's one of those things. Either way is fine. I've been trained in
Tomato,
tinnitus, but some other people have been trained in tinnitus. So
Yeah,
I'm not going to
it's
argue the
either way.
point. It's
They're
the
both
same
fine.
problem.
It just depends what part of the country you're in, I guess.
Right.
Oh my gosh.
But I tell patients all the time, they come to me, I have this terrible ringing in my ear. I say, well, do you notice hearing loss? I really don't notice any. I say, well, a lot of times it's associated with that. You really should be referred. And sometimes they'll buy into it, but a lot of times they don't want to go for a hearing eval.
And the problem is the hearing eval was covered by insurance. We have a more extensive tinnitus consultation. It's not.
Okay.
And so it's amazing how many folks we can cure by saying, well, the visit will cost $370. And they'll say, oh, I'm fine. So it works.
But it can be really disturbing to patients.
Yeah, it can be. And then I had a woman I remember vividly. She came in and she looked like she had just dragged herself out of bed to be there. She didn't look well. She looked just tired and drained. And we gave her some techniques. We got her hearing aids. And then it was that winter where we had snow every Monday.
Right.
We had no work for every Monday. I think it was 2008 or something. I didn't get to see her for several weeks because just the snow. And by the time I saw her, I didn't recognize her. She was made up, hair done.
Really?
And she said, I feel like I have my life back. And all she had done is done what we told her to do. And that's the thing, is sticking to that, having overnight sound enrichment. So you're never in silence, doing relaxation techniques, whether that's deep breathing, yoga, meditation. And all of these things can make a big difference. Yeah.
Why do certain air conditions cause balance disturbances?
It depends. So our vestibular system is very much connected to the ear. So we have our cochlea to hear. Behind that, we have our semicircular canals that handle balance. Most common is BPPV, benign paroxysmal positional vertigo. Big scary word. Just means there's loose calcium crystals in the ear.
Okay.
And folks will notice it and they say, I turn over in bed to the right, I get dizzy, and it will last just a few seconds.
Right.
That's a very simple fix for that. We can do some positional movements with a PT, and it can be done in one session usually.
Patients are always amazed at that when we send them for the Epley maneuver through physical therapy, and they have 1 or 2 sessions and it goes away.
Do you know my mom complained about that for like 20 years?
Really?
And
If it is,
she can never
it's
she can never
very
turn to her
treatable.
left side.
Yeah.
Yeah, it's very treatable.
Very treatable.
1 or 2
Really?
physical therapy sessions and it's gone.
I
And
can't
it's
tell
all-
you
Come
how
back,
many
but it's
times she was
gone.
admitted to the hospital, and they always put the sign above her bed, don't turn to left side.
Yeah.
Right. And it's very much associated with a vitamin D deficency that can create those calcium bonds to break down. And then they have those floaters in the ears.
Yeah. A lot of times they're, labeled as Meniere's, but it's not really Meniere's. It's
I don't see it as
so-
much, but early on in my career, I'd see people on meclizine for 20 years. So I'm
Right.
thinking this should be
Right.
PRN. It's not something to be on for the
Right.
rest
It's
of your
also,
life.
and it's a drug that causes falls in the elderly and confusion. It's not a great drug. So.
Right. And we see a lot of vestibular with anxiety or vestibular migraines where they don't have your typical migraine presentation, but it'll come once a month. It's usually women, and they'll struggle with that. So there are definitely balance centers that can help with that.
Yeah,
We used to do a lot with balance, but unfortunately reimbursement was ridiculously low, and it wasn't worth the 2 hours we had to take.
Although it affects someone's lifestyle to
Yeah.
like the nth degree.
Yeah,
it
absolutely.
really does.
You
Yeah.
do a lot if you don't balance.
So hearing loss, tinnitus or tinnitus.
Tomato, tomato.
Tinnitus.
What else do you deal with as an audiologist? Are those the main things, or are
That's
there
our
other
primary focus. I mean, we clean out ears from
Yeah.
wax. It's the highlight of our day right before lunch. I've just started doing some beta testing with auditory training because we have a lot of patients, and you've probably seen some where they say hearing aids don't help me. I have them and I still can't hear,
Right.
understand. That's often an issue with their auditory nerve. So auditory training is something they do with cochlear implant candidates or folks with central auditory processing issues, where you're retraining the brain to recognize the sounds you're hearing, almost like learning a new language. So we worked off the hypothesis of what if we did these with our folks whose word recognition, even when things are loud enough, is 10%, 20%. That's an uphill battle. They're never going to feel like they hear well with their hearing aids.
Right.
So I have my first person that we're going through it now, and her her aided word recognition in quiet. So hearing aids on, just a quiet thing, say the word book, say the word, car, was at 40% with her hearing aids programmed the best that she can. We just did 6 weeks. There's another 6 weeks to go, but I took a midway testing, and her word recognition scores went up to 80%.
That's good.
Wow, they doubled?
They doubled. And then we did her testing in noise. First time through, she got 30%. Second time, 65%.
Oh my God, she must
And
be
she said,
happy
this
with
doesn't
that.
make sense, but I don't feel as tired. And she said, I was having a lot of issues with stumbling. I'm not doing that anymore. So that's that cognitive fatigue component.
Yeah.
So
Oh my gosh.
I'm doing it with a few more patients to see if this is, valid.
Right,
If it is,
right.
it's going to be something we offer, because that's been something that's bothered me since the beginning of my career, feeling like you couldn't help somebody. We had all the tools, but you couldn't get past that point because of the system.
Right.
Yeah.
I know it's a little off topic, but the cochlear implants are amazing.
Yeah.
That are out there now. And I have some patients who, they have had hearing loss for so many years of their life, and then they have the implant and they can now talk on the phone or communicate.
It's life-changing.
It really is. And then so it's really interesting. I had one patient, and she was in the medical profession. She was having a lot of difficulty. She was struggling. She went for a cochlear implant. I had a couple other patients who had similar issues. And so she said, you could always have someone call me. So I had this person call her, and then they got it. And then it was the same thing. It became like this snowball effect. So I have a handful or so, maybe 10 people now that have had them, and it's absolutely changed their lives.
Yeah, and I have so many patients that are so hesitant because we'll
Right.
often send people for consultations. Obviously, we don't do it. It's surgically related, but
Right.
I have people I know I can't help them. And I'll say to them, I wish I could. I can't help you. I'd be selling you a hearing aid just for the money, and that's not what we do this for.
Sure.
I don't want to go. It's surgery. I don't want to go. Please go get the consultation. And I have a list of patients myself that I can share with them that have had it, and they're just so scared of the process, and it can be life-changing. And it used to be they didn't do them on certain age levels. I've seen people in their 80s get them now, and it's changed their world because they go from not hearing to being connected
I
again.
haven't had anyone be disappointed.
Correct.
I mean, everyone is really happy when they have it done.
I think part of it's because early on there was some disappointment, but that was 20, 30 years ago.
Sure,
They've come
sure.
a long way.
They really have.
Because now they have some that are hybrids, where they have a hearing device that can pick up the sounds they can attain with hearing aids, and then they have the electrodes that go into the cochlea to stimulate the sounds they can't.
Yeah.
And they also work with cell phones. That if you have a normal hearing aid on one side and a cochlear implant, you can stream them together on your cell phone. So they've really
God,
come a
that's
long way.
wild.
That's really amazing.
Yeah.
The technology.
Oh yeah, and I mean, just in my career alone, I'm amazed at how far we've come, and that you don't see that all the time.
Yeah. So what's next?
I don't know. I'm excited to see.
It's remarkable.
Yeah, like I said, we're doing a lot more with trying things out because our neck of the woods, we don't get a lot of the research that comes from, Boston and whatnot. And we're seeing more and more, they have music therapy now because they're finding people who've played instruments throughout their life. They hang on to their word understanding longer because they're using more of their brain.
Okay.
So now there's musical therapies you can introduce for your hearing loss patients to try to keep some certain parts stimulated and do better. So we're looking at all of these things and seeing, what's next? What do we want to add next?
Should take a guitar to the office.
Yeah.
So yeah, you play instrument. You should be good for a while.
I should be good for a while. Yeah. Well, I
Just
mean,
protect your ears.
right. I really do try to. So we're really pretty careful with that.
Yeah,
But,
they found musicians and athletes because athletes, especially like football players, you have to learn to shut out the noise,
Yeah.
focus on what you're
Oh.
focusing on. So they found they were able to use different parts of their brain to help with that.
Well, it's like you say, if you use your brain, there's less chance you'll develop dementia like any other part of your body. If you don't use
Exactly.
it wastes away. But they've done studies on patients who speak multiple languages that they have less of a risk of developing dementia.
Absolutely.
So most Americans are in trouble because we don't speak other languages.
I can barely speak English most days.
But you go to Europe and it's not atypical to speak 4 or 5 languages.
Absolutely. Yeah, we have a few staff members that can speak 2 or 3 languages, thankfully. They help me and save me all the time. But
Sure.
yeah, it's amazing. And just the level of intelligence you have to master multiple languages.
I'm always amazed by it.
Yeah,
It's
you have to
remarkable.
just switch like that. So yeah, it's incredible.
All right. Well, now, do you have a message that you'd like to leave our audience with?
Obviously, protect your ears at all costs because you can't
Mhm.
turn it back. But start early, get a baseline when your hearing's normal so that you have the ability to have something to compare to down the road if there are changes, if you start suspecting
Yep.
changes. And just like vision care, start young because the earlier we can catch things and fix them, the better off you're going to be long term.
Right.
So we recommend coming in before you have a problem, and then we'll just continue monitoring every few years.
That's
Good
great.
advice.
And how do patients contact you?
Your best bet is to go to our website, duncanhearing.com. We have 4 locations, so you can see which one fits your geographical location the best. We're in Fall River, Dartmouth, Falmouth, and Centerville now. We just moved
Nice.
from Hyannis. And when you call, we'll set you up with the appropriate office, the appropriate practitioner. But if you go to the website, all of the numbers are there, all of our contact. You can even contact us via email, and we'll be happy to help you. Take care of you any way we can.
That's great. Excellent. Well, thank you so much.
You're welcome. Thank you
We're
for having
really
me.
appreciative. This was a really, I think, great discussion. I learned a lot. I'm sure that our audience will learn a lot also
I hope
about
so.
hearing
Thank you.
loss, how to protect their ears, and not to be afraid to ask for help, because I think it is scary for a lot of patients. They get.
I'm seeing a shift
yeah.
over the last few years. We're seeing a lot of folks in their 30s coming in just to give a test, which I encourage because
That's
it's
great.
important to monitor all our health systems. Wellness is better than treating reactively.
Sure, absolutely, no
Right. I
doubt.
agree.
Well, Dr. Duncan, thank you very much. We
Thank you for having
appreciate it,
me.
and thank you for all of our listeners for listening to our show. And if you'd like to become a sponsor, please contact us at 774-319-4230. Special thanks to Ron Gamache for our intro music, and BioSkills of Northeast for producing our show. And of course, Bay Coast Bank, our sponsor. Bay Coast is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. Once again, thank you very much.
You're welcome. Thank you.
Yeah.